Okay, we are going to go ahead and get started today. Today, the topic of the webinar is on Standard 11, which relates to child development services. But before we dig into that, we're going to do our discussion like we do every webinar about the difference between policy and procedure and how that works and what kind of the expectation for that will be as you get ready for the next peer review or as your program prepares for the initial credential. So policy is really intended to be that broad application. It will get at those questions that relate to the standard as far as like, what does the program do? Why does the program do that thing? It rarely changes. It's pretty broad in nature, or that general kind of guiding principle. And those are usually approved by the board, whether that be like a program's like board, like maybe a advisory council or something like that, or it would be for the organizational standards, the board of directors or whatever, board of trustees, the governing board, whoever that board is. For procedure, those are going to be the ones that change more frequently. They're more narrow in application. They describe a specific process or protocols. Usually, there would be some sort of like do this, then this, then this, like 1, 2, 3, 4 kind of process. Those do change more often. They change as maybe funders' requirements might change. They change as maybe even the standards themselves change. Maybe there's an addition to the standard that you need to nail down for procedure. And those generally don't need board approval. Some programs will still have that included as will be something that gets approved by the board, especially like advisory councils for program standards. And then, as we're going through these standards on the webinar today, look for that logo, the one that says the procedure boost, because those are really going to be the slides that have to do with kind of that added expectation for the Iowa Family Support Credential, those pieces that are really going to make your as you're preparing for the peer review, that are really going to nail down everything and make it super clear to the peer reviewers exactly not only what you do, but how you do it. And it really eliminates the need for peer reviewers to kind of have to get at those things via panel interviews, because it's already lined out there in the procedure for them to fully understand how a process works. The other thing that I want to talk about, and we always talk about, is the importance on the revision dates for policies and procedures. It is a requirement for programs to have those on or have some method of tracking those revision dates in order to be eligible for the expedited renewal. So if you as a program, if your program earned greater than 90% in adherence on the last peer review, you could be eligible for the expedited renewal. However, the only way you could be eligible is if you have a method by which you track those change dates. So you could, I've got a couple of examples of ways to do it. You can have this top one is like kind of a header of the policy or the procedure. It kind of talks about the effective date, the dates of revision. That would be one way of tracking it. Another way that other programs use is a spreadsheet that has like the policy name or the procedure name, the effective date, revised dates, and so on and so forth. But you definitely want to have a method for tracking that, because when we go back to prepare then for those expedited renewals, one of the questions on the application is what standards have you revised since the last peer review? And then those automatically get included in the renewal. The other thing to kind of touch on here very briefly is the difference between policy and procedure, kind of as an example. And we kind of have here like a broad policy, like an overarching thing. And then, you might have several procedures underneath that policy. So for example, if the agency offers paid time off to all part-time and full-time employees, it might be that the procedure has several underneath of those, like the PTO is how PTO is requested, what days the offices are closed on. And you could even have some things underneath the procedure that are really specific to a funder. For example, how the direct supervisor reviews the PTO requests, how approvals are granted based on a variety of factors, program needs, funder needs, those kinds of things. So there could be, like I said, there could be multiple procedures under one policy, and we see that a lot, and that's okay. Don't feel like you need to put a whole bunch of everything for one standard in one procedure. Like you could break it down. It happens all the time where we would have be pulling things from multiple different procedures to kind of meet under that one policy. So with that, we're going to dig right in. Standard 11 is child development services. So we've talked a lot over the last couple of webinars about various components of the home visitation and group-based parenting programs. We've talked about how the setup of the curriculum is. We've talked about how families are linked to various referral or community partners, all the different situations where there might be a referral that's made. We've talked about all those kinds of components. This is kind of that last component, and this is really specific to child development. So this is how does the program ingrain child development into the program. So the first order standard is that children receive services that meet their needs, promote their growth and development, and increase their well-being. First thing we want to note here is that this standard is only applicable to long-term home visitation programs with or without group components. It is not applicable to group-based parent education programs or short-term in-home family support services. So if you're with one of those programs, this actually the standard wouldn't apply to you. And then one thing to kind of note throughout this is the standard is specific to child development services that are done in a couple of different ways. For standards 1102, 1103, and 1104, these are like things that are directly provided by the program. For standard 11.01, these are these ensure families are connected to types of different child development types of things. So when you're reading those through those second order standards, look for those words that kind of clue you into what the standard is looking for, whether it be provided directly by the program or connected. So standard 11.01, here we are, we've got that first one. Children are connected to supports and services and activities that promote their physical, cognitive, social, and emotional development, including as appropriate, educational services, counseling and therapeutic services, health services, and social, recreational, and physical activities. Again, it's applicable to long-term home visitations with a group component or without. So as we look through kind of what we're looking for policy on this one, again, what does the program do? Why? So kind of some questions that you might ask yourself as you're putting this together is, what support services and activities that promote child development are children connected to? And this is where we want to think really broad, not specific entities. This is in our policy. We're not gonna call out those specific things, whether it be AEA or various other like hospitals or clinics that might provide physical therapy or other types of things. We're not going to call those out specifically here, but this is broad. And we don't want to list those provider names or clinics. Just make sure that what we do list are specific to child development and not supportive services. So things that wouldn't make sense to put in here would be things that relate to the family well-being. Might be like, and I suppose some of these things, as I kind of think through them on my head, you could stretch it and call it child development perhaps, but I'm thinking like housing information, but if that housing is needed because of a child development type of thing, then that might be appropriate. So yeah, I just think that we want to be really specific in how we're thinking about this in terms of child development. And really, as we look through this whole standard, I get this question a lot, like, what exactly is the difference between standard 11 and standard 10 in places and standard 8 and 9 in places? And then the answer there is child development. So what types of child development are included? Again, we want to think in broad child development topics. We want to think about all the different types of child development domains that are out there. For a procedure, this is where we're going to kind of nail down all of those little pieces, this procedural steps, who does what, and where is it documented, basically. Address physical, cognitive, social, and emotional development. What does the program do to ensure families are connected? What actually are they doing? Where is this documented? how would a peer reviewer know that that's happening? You know, that kind of thing. And really, as you finish up your procedure and writing procedure for all of these, for any standard, you know, go back and ask yourself, like, okay, so how will the peer reviewer know that this is being done? And if the answer is they have to ask that question, perhaps, and I'm not saying every time, but perhaps there's some things you could do to nail down your procedure a little bit more. If it's like, oh, it's going to be answered in an interview, you know, there may be other ways to show that. Not always, but sometimes. Include educational services, all those educational services, counseling and therapeutic services, health services, and social, recreational, and physical activities. How are those incorporated into child development connections? Again, as the program is making those referrals or those connections, you know, that purposeful planning piece, where are those documented? And again, we want to make sure that we're thinking about all the domains of child development, not just gross motor or fine motor development. I think those are the easy ones to do. But we really want to make sure that we're, as a program, you're being as broad as possible and thinking through all of those various potential needs. And I know that in rural communities, some of these might be hard to come by. It might not be that you have multiple places to refer families to for each one of these topics, and that's okay. You know, or it might be that like one place does a lot of these things. And so again, that's okay too. Just make sure you're thinking through it all and explaining it all in your procedure. So for the practice for this one, it's really pretty limited. You know, you might have a referral log depending on how things are documented. So you would put a blank referral log in your non-PHI, your box. Might have releases of information, again, blank, those would be in the blank document in the non-PHI box. You could potentially include community resource guides, and that's a good one. But we want to, if you do that, make sure that you highlight and label those standard related topics. The peer reviewers aren't going to be so familiar with your community that they're going to know, oh, this clinic does XYZ types of things, or even that like this hospital chain or this you know, pediatric clinic covers these types of things. You really want to make sure that you're explaining that to the peer reviewers, what exactly those things are for. Be sure you include all of the types of development, physical, cognitive, social, emotional development as related in the standard. And then you could also use handouts from applicable support services and activities. And those are all kind of the bullet points within the standard. So, you know, sometimes when you're linking a family with a resource or you know, something going on in the community, it might just be a flyer. You know, maybe the family, maybe that there's a potential child development concern with a child that relates to, gosh, I don't know. I'm thinking gross motor. I know my library is having a drum clinic coming up, and so, you know, I think that I can make that connection for certain age children with a gross motor type of delay, that there would be, you know, maybe there's a referral there that, you know, going to a clinic or going to the hospital or the library, and you know, some of the gross motor skills that would be taught with using a drum, I think could be a really creative way to do that. So make sure when you're doing that, you know, you don't think of just your, you know, very small or, you know, your specific things in the community that are like clinics and those kinds of things, but even consider like community events. I can think of all kinds of ones in my community that are kind of, I mean, maybe they only occur once, but they might be a good referral to get the family out and get them interacting with other people and start kind of thinking about some of those things. And then in the PHI portal, which is what will be uploaded for the peer reviewers to review, would be those participant files. And in there, they might be looking for those completed referral logs or a completed release of information. So common missteps for 11.01, I really didn't find, there wasn't a lot in here, like in terms of a lot of different examples, but we did see some where the program policy and procedure contains all of the necessary elements, but the participant files didn't document those conversation on topics that were tied to those areas. So the peer reviewers really were able to, the policy and procedure had everything kind of described there, but the participant files weren't showing those things. So we want to make sure that, when you meet the standard, you're going to need to be documenting those referrals as well as those intentional planning for home visits and for groups, making sure you're bringing information on various community resources and things like that that might encourage or grow child development. Even those informal resources are important to document. And it may also be necessary, it may be a good idea to document what specific child development related activities that resource would be addressing. Again, because not all, peer reviewers might not necessarily know or get what you're going for there. So standard 11.2, child and family characteristics such as age, developmental level, race, culture, ethnicity, and language are considered when choosing or designing program interventions, materials, and curriculum. So the one thing that we want to say here, there's two things that kind of come up. One, this looks almost identical to standard 10.01. However, 10.01 relates to parent education services. So that would be like the program interventions, materials, and curricula as it relates to parent education. And then standard 11.02 is those program interventions, materials, and curricula as it relates to child development. So, be really specific on what you include in this one and in 10.02 that it relates to those various components. The other thing to say here is that a lot of times we get a lot of confusion about what the standard is saying. So this standard is all about overall program selection of those materials. It is not about individual selection of those materials for the family. So it's not saying that if you have a family that speaks Spanish, that we need to bring in Spanish materials. That's not what this standard is about. That's some other standards. This standard is about selecting the education or intervention materials and curricula for your program based on the needs of your service population, the families that are enrolled in your program and in the community. Again, it's applicable to long-term home visitations, both with or without groups. On standard 1102 for policy, so there's a couple of things to think about here. What is important for you to consider when choosing or designing curriculum, educational interventions, and materials? Hint, it's the child and family characteristics. So make sure that you're including that in your policy. It kind of feels like, this is kind of, I'm saying the same thing as the standard, and that might very well be, it kind of makes sense for this one because there's not a lot to expand on, but you can word it in a way that works for your program, word it in a way that works for you to make sure that it's makes sense for implementation, or you can word it exactly like the standard does. It's completely up to you. And then the other thing to think about is what is the focus of that curriculum? Again, the hint there is it's child development. Please don't copy and paste what you use from 10.01 because that's really relating to parent education services. And the way that it might mean that you use the same primary curriculum. It might be that PAT is the same as what you're doing for both of those, but what you would submit, we'll get down into that, what you would submit for your evidence is going to look a little different, I think, because what you provide for parent education services is different than child development. There's some overlap, arguably, but child development is a pretty specific component there. And so, first of all, just calling that out in policy, like this is what we're doing. We do select curriculum, educational interventions, and materials that are specific to child development services. So for procedure, child and family characteristics are considered, the various components, age, developmental level, race, culture, ethnicity, language, and literacy. So where do you collect this information? How do you know who what those things are for your community, for your service population, for your enrolled families? How often do you review that? Do you as a program? review that data and then reconcile it, kind of that whole, okay, so this is what our community demographics are. Here's what we've got for curriculum. Does this match up? And then who is involved in that process? Is it an advisory council? Is it maybe you get together a special group of individuals from the community and families that are enrolled in the program, whatever that looks like, who is involved in that process? And I think that, when we say how often is that data reviewed, probably the thing that we see a lot, probably the most with this one, is that like you really select a curriculum maybe once, and then you probably don't go back and think about it again that often unless it's not working for you. And the standard is intended to be that like purposeful review and purposeful decision that yes, this is the curriculum for us going forward as well. It continues to meet our needs as a program based on our demographics. And then the other thing here for procedure is that child development services relate to program intervention that are selected. Sorry, let me reverse this one. Program interventions, curriculum and materials relate to child development services. Again, I'm just going to continue to hammer this because I see so many times that standard 10.01 and standard 11.02 are verbatim the same, and they're very similar, but they shouldn't be exactly the same. And definitely the evidence for those should not be exactly the same. So what are we looking at for practice here? Meeting minutes or agendas that show that intentional discussion on either program or organizational level on, the curriculums. Completed participant surveys, if they cover child development, that's one thing that you could certainly be asking families about, and then make sure you're kind of covering all of the various components in there, and then ask for their feedback. How's the curriculum working? The current curriculum working for you? What do you wish that you had? That those kinds of things, and make sure it's specific. If you do go that route for the survey, make sure that it's very specific to child development. Community needs assessments, you could definitely pull from that, highlight some things from the community needs assessment that are specific about the community that could impact the educational interventions, materials, and curriculum. And then also you'll want to include in there specific documents from your selected curriculum that that are related to all of these things, but then also relate to child development. And really for the PHI portal, what would get uploaded, because it contains protected health information, really is just going to be those completed participant surveys if that's the route you go. Common missteps for 1102. Let's see here. That the curriculum selected by the program met the child and met all of the various components that was necessary for child and families enrolled in the program. However, there was not really any procedure that described how that selection occurred, so that there was no kind of discussion about like, okay, when are you doing this next? How often do you do this? How did you come to the conclusion that worked for you, or for your program? So the procedure there, addressing how the program-wide decisions are made, is really important. Clearly, I didn't finish my thought on the end of that one. I apologize. And standard 11.03 is the next one. And this is really when we think about like home visiting and like what we do at the visits. This is kind of the what we do at the visits part. Parents are involved in service delivery, and providers help them increase their ability to interact positively with their children and promote child well-being. So for policy, what we want to look at there is, what is the parent's role in child development services? Their role is to be involved. How do you get those families involved? The providers invite participants to invite parents into visits to be a part of the process, rather than just sitting down and lecturing, like, this is what I brought for you this week, and and the family's kind of off doing whatever. What is that role? How do you bring them into that? And then what is the provider's role in the child development services? obviously it would be to increase parents' ability to interact positively with their children, also to promote child well-being. For procedure, kind of, so I talked a little bit about this more back on policy, but these are kind of like the how do you do the standard kind of questions. How does the family support professional engage families to participate in child development content? What developmental screens are done? And that one kind of leans a little bit into 1104, but that could be part of it. How are they done? Especially talking about that, like with the parent, involving the parent in the process. I see a lot of times, the programs that do developmental screens that just sit down with the child and just do them. And really that's not really getting at the intent of the standard here. It's that inviting the families to be a part of things and really having the parent even kind of drive that process, that they're doing those things with the family or with the child, rather than it just being a checklist that you're going through with the child as the family support, or family support professional. And then, where are things documented about that engagement of the families and, what their responses were to things and how things went. How does the family support professional incorporate child development into visits? So that's that curriculum on child development, observing and sharing parent-child interactions, kind of that, the nature of that relationship back and forth, and then documenting that, making sure that in the home visit notes that those things are included in the visit. Not only like this is the curriculum that we brought, but then also like what is that parent's response to that curriculum? So then where is that documented? So for practice for 1103, one way that you could kind of determine if families are progressing in their knowledge on child development would be to do surveys, parent knowledge surveys on child development. So you might include in the box those blank surveys that's conducted at various intervals to show growth. Table of contents from program interventions, materials, and curriculum that are highlighted for standard-specific content. And then beyond that table of contents, you would really want to include in there some examples of like those full handouts that are used, or the full, article or whatever that's shared with families, so that the peer reviewers can really see what the content of the curriculum looks like. Blank developmental screening and assessments that are used. So this would be like, if the program is using developmental screening as part of a way to engage families in child development, and really using that as a tool to both invite them into and to grow their knowledge, you could include in there the blank developmental screenings. You definitely want to consider, because there's going to be a lot of standards that you would include those ASQs or whatever that is in, but consider putting them all in a folder to reference throughout all of the standards, rather than putting them like all of them in every single standard. That just is like kind of a lot of space in a physical box or a digital box. And then blank contact notes or home visit note forms. You definitely want to highlight on there where these pieces are documented, that parental involvement in child development, or those developmental screen results where that's noted in there, that that parent-child interaction and the discussion about that, and that you want to highlight where that would be at, where that would be found, so that when the peer reviewers are going through those contact notes or those home visit notes, that they would know where to look for those. And then in the PHI portal, it would be completed versions of all of those things that were the blank versions out here. Missteps for 11.03. The only one that we really had for this one was it's a very specific example, but I thought it was a pretty good one. So I included it here. It was that the child development services provided by the program focused primarily on that age of like prenatal through 18. So like they had 18 months, sorry. Even though the program served families prenatal to 5. So the bulk of a lot of their materials really were prenatal to 18 months, even though they were working with kids older than that. And so We want to make sure that you're doing, completing those developmental screens, obviously beyond like for the full period of time. But then also, your contact notes support that you have a specific like focus of the home visit that focuses on child development. You talk about lots of other things and goals and how the family's doing and maybe lots of other areas, but making sure that you're really focusing a portion of the time on home visits on child development. And then there's a specific place in the notes to document that, because otherwise, again, the peer reviewers might just feel like that's something that got missed quite a bit. On 11.04, this is the last standard for this one, and this one is kind of what everything has been building to. So when assessment reveals the need for early intervention services, the organization either directly provides those services or links the family with another organization or agency that provides those services. Most programs that are family support, that receive the Iowa Family Support Credential, and that are family support programs in the state of Iowa, do make referrals. They don't provide those themselves. They make referrals to early access, to AEA, those kinds of things. So for policy, what does the program do to determine if a child has a potential developmental delay? Of course, they do the developmental screens or assessments. What is the system for the developmental screens? It should be on a set schedule, not as needed. So there should be kind of that. Your policy shouldn't say like, when we think there's a need for it, we screen that child. It should be like, we screen children at XYZ frequency, and we'll discuss that in the next slide on procedure, because that's maybe a little bit more procedure. And what does the program do when there's a potential developmental delay that's been observed or that's been kind of screened for? Either they can directly provide early intervention services, which again, like I said, most do not, most programs do not, or make referrals to other organizations that provide those early intervention services. So for procedure, on conducting those developmental screens or assessments, we want to make sure that we cover in procedure like what developmental screens or assessments are done, how often are they done, and how often. I know for most programs funded by ECI in the state of Iowa, you have your ASQs, and those are done on specific intervals. Make sure that's documented in your procedures, what that interval is. It should always be the peer reviewers and any new family support professional should be able to come in, read that policy, look at a family, and know when to do the next one. It should be really easy to figure out. Where are the results of those developmental screens or assessments documented? And then where are conversations with families about those results documented? When it's necessary to make a referral to early intervention services, where are those referrals documented? Are releases of information completed? And I know that's kind of sometimes, or some programs say all the time, whatever your program's policy is about that. And then how are referrals followed up on? And then kind of the next one of that one is like, where are the follow-up on those referrals documented? For practice, releases of information, we would have the blank documents, referral logs. Oh, golly. Nope. Let me try that again. There we go. For referral logs, blank documents. For developmental screenings or assessments, again, consider putting them all in a folder to reference throughout the standards rather than needing to put them all in every standard that talks about them. And for contact notes, highlight those documents that are, like you want to include a blank document that's highlighted of where the results of developmental screenings and our assessments are documented. In the PHI portal, the stuff that will get uploaded for the peer reviewers to review, it'll be all from the participant files, and it'll be those releases of information, referral logs, contact notes, and the results of those developmental screenings or assessments. A couple of common missteps for 1104. The program makes referrals to early intervention services if a developmental delay in a child is suspected by the family support professional or the parent, but there's no mechanism to facilitate that developmental assessment or screen. The standard really does require that the program have a developmental assessment to discern if there is a potential developmental delay. So just being like, if we think there's one, then we're going to make a referral that does not meet the standard. You have to have a one that's cut, a developmental screen that's being used, and it needs to be documented in the procedure of the policy, and then kind of those frequencies, how often it happens, those kinds of things. The program utilizes developmental screenings to determine if a referral is needed for early intervention services. However, the developmental screening tool utilized is not comprehensive, doesn't cover all the domains in child development, instead focuses only on like one domain, for like example, gross motor development. Yes, I understand that, and I'm not saying that the ASQ SE is required there, but I understand that that is optional for ECI funded programs. Moreover, like what this one is, and the example that it came from was like, this program was only looking at gross motor. And really they were kind of ignoring cognitive and fine motor and problems. I think they were ignoring, they weren't screening on other types of other domains of child development. And so that child development assessment should be comprehensive and include multiple domains. So that is all I have for today on Standard 11. There is my contact information, our website and our Facebook and YouTube pages. We are going to be taking next month off. We won't have one in June, mostly because I'm on vacation. And then we'll pick up again in July. The link has been posted to the website and on our Facebook page. And I sent an email blast out. If you didn't get it or you're not part of our email list, shoot me an email and I'll get you added. Thanks.